Welcome to another episode of Plus Talk on Plus Life with our favorite medical advisor, Dr. Anu. Welcome back, Doc.
Hey, how are you?
I'm good, but more importantly, before we dive into today's show, how are you doing? Because you're there on the front lines, you're seeing a lot, you're dealing with a lot. How are you holding up?
I'm still going. I think there isn't much to ask. This is what I signed up for, so it's my passion, and I have to keep going whether I feel tired or not. And I'm passionate about it, and this is what's required of me. No ifs, ands, or buts.
Well, we're all very grateful for that, and I'm so glad you're able to take a few more moments out of your very busy day to chat with us. We've had a great response to the last episode we did together, so let's dive straight in. I've got a whole lot of questions for you. We've got some viewers who are calling in, but I want to ask you first up some HIV COVID-19 related questions. As we know, and you and I have talked about, if you're HIV positive and you're undetectable and you're healthy, we're sort of at no greater risk than anybody else. But there are some people who are living with HIV who have other conditions like cardiovascular disease or lung disease. So do those conditions increase the risk for a more severe course of COVID-19 if someone's HIV positive and should get diagnosed?
It's not the HIV portion of it. It's the diabetes and the heart condition portion of it that would increase the effects or the inflammatory response seen in COVID-19 infections, if that makes sense.
No, that makes sense. So what should HIV positive people do who develop COVID-19? Is it any different once they've got it because they have the HIV, or is it the same as everyone else?
I think this goes back to what we're trying to do, right? Is break that stigma. So if you equals you and you're undetectable, your body essentially is functioning just like normal. So it is just the same advice that I would give to anybody else that was completely healthy, that got diagnosed with COVID-19 is rest, hydrate, treat it just like any other viral illness or a cold. And we would treat according to your symptoms and how bad it is.
Okay, great advice. All right, well, I want to throw it into our first viewer question. We've got Dimitri on Skype, and he's got a question for us.
Hi, Carl and Dr. Anu. My question is, I've been having a couple of conversations with some of my friends, some of whom are older living with HIV. And one friend in particular talked about how this COVID-19 experience was bringing up a lot of past trauma. So is there any advice you can give to anyone out there who may be reliving or re-experiencing any past trauma due to what's going on with COVID-19?
That's a really good question.
That's an awesome question. I would like to start off by saying that I don't think that they or you are alone in feeling such feelings. This is dredging up a lot of past memories, past experiences, new anxiety, new depression. And what I'd like to say in terms of that is, number one, is don't push away those feelings or what you're actually experiencing. Accept it, digest it, go through with it. I think I would even say talk about it. So this is where using social media is to your benefit. Talk about it with your roommates. At least if you are that roommate and you're seeing that another person is struggling with anxiety and depression, approach them, ask how they're doing, and be a listening platform to them. They need to get all those feelings out. And I would encourage them and encourage people in general to reach out to their physicians, reach out to their therapists, reach out to their psychiatrists in dealing with this. And I think that when events like this happen, it's also a reminder that maybe we really haven't dealt with some of these feelings that we had from the past. Maybe we really haven't accepted it and really put it away or really dealt with it because it's coming back up, right? And when it comes back up, it might come back in twofold. And so this is an opportunity to actually deal with it now.
That's really great advice. Thank you. Let's go to another Skype question. This one is from Jeff. What's your question, Jeff?
Hey guys, Dr. Anu, I have a question about COVID-19. I was wondering, once you've been tested positive, does that mean that you are no longer susceptible to the current strain of COVID-19?
Great question, Jeff. I'm glad that you asked this. So just like influenza and the flu, COVID-19 and other coronaviruses can mutate and cause different strains. And this is where we talk about reinfection. So yes, you can get reinfected with a different strain of COVID-19 per se, but it won't be called COVID-19. Maybe it's another type of coronavirus.
And how will your body likely react to that? Is it like getting it all over again, or have you built up some kind of immunity?
You know what? I really can't answer that question. We really don't know that answer because unfortunately, to certain viruses, if you do get reinfected with it or a different type of strain, your body kind of realizes it and detects it quicker and may suppress or give you diminished reactions to it. And then with other types of viruses, the more you're hit by it, the stronger the reaction. So I really cannot answer that question completely.
I think it's too soon to tell, isn't it? I think that part of the anxiety that everyone's feeling is that have so many questions and there are so many unknowns. I mean, this is a totally new thing we're dealing with.
Yeah. And I think that I'd like to take this opportunity so that I can express how I'm feeling right now too. And it is emotionally challenging because as a physician, what we're taught to is prevent illnesses, diagnose them, treat them, and then educate people regarding that. And we're just picking up and things are changing day to day, week to week. There's more studies that are being done, more research that's being done on treatment options. And if somebody comes to me that is really sick from COVID-19, I don't have a standardized treatment plan for them. And that's a scary challenge. This is where I think my inner drive comes in and just almost like a reflex, that survival reflex that one has. You just go through and you want to stabilize that patient, get them to where they need to be, which is in a hospital or in the ER, and then take it from there with a collective approach. This is what's happening in multiple hospitals. Infectious disease is on board. Pulmonology that deals with lungs is on board. Allergy and immunology is also on board. Then you have the ICU specialists, etc. So a whole team of doctors are actually working together to take care of patients. And it's amazing to see.
Yeah, it certainly is. You ready for another question?
Sure.
Okay, here we go. Can I get COVID-19 in your house with the windows open or the air conditioning on? Now, that might sound like a pretty straightforward, silly question, but it's actually a good one.
I actually just got that question from a patient just this morning, so I have a great response for you. And the answer is no, unless your window is literally right next to your neighbor's and he sticks his face out right when you do and sneezes on you. That is the only way. So again, the droplets that are contagious, they're respiratory droplets, they're pretty dense, and you'd have to literally sneeze or cough onto something, touch it, and then touch your face, mouth, nose, eyes. So you can leave your window open. There aren't little COVID-19 particles that are floating around in the air and can float into your window and infect you.
Well, I'm happy to hear that. We've got another one for you, Doc. Diagnosed HIV positive in October, and my CD4 count is still very low. Medication compliant and apparently already resisting Biktarvy, which is the HIV med that a lot of us are on. Am I at a greater risk?
Unfortunately, here is where I'm going to have to say yes, you are, because your immune system is not functioning the way that it should. With CD4 counts that low, I really, really, really ask you to go immediately to your doctor or seek another doctor, HIV specialist that can place you on a different medication to bring those counts up as soon as possible. CD4 cells are helper cells. They're part of the immune system that recognizes viruses and bacteria that shouldn't be there and brings other members of the immune system to actually rev up and fight what's there. So if you don't have that and your counts are less than 500, you're not only susceptible to viral infections such as COVID-19, more susceptible to viral infections such as COVID-19, but you're also susceptible to really serious bacterial infections such as pneumococcus.
Right, but it's not cause to panic. It's cause to get in touch with your doctor and
Right.
speak to them and see what the new course of action should be.
Exactly. And again, even with your counts being this low, I just want to add and stress the importance. If you do take the hygienic measures that we are implementing, don't touch your face, wash your hands, socially isolate or contain yourself, you are still protecting yourself, and you can always utilize the phone and virtual visits to get the help that you need to slowly build your immune system back up. So please don't panic. Thank you, Carl, for stating that.
Well, telemedicine is taking off here in the US. And also, CVS now delivers my medications to me at home. So, and that doesn't cost any extra if you sign up with various pharmacies. Here's another one for you. What can I do? I have to go to work. I work at a gas station. If I don't go, I'm going to lose my job. How do I keep my family and I safe from this? So that's a good question. People who are still in these jobs, who still have to go to work, they don't want to bring this home to their families. What can they be doing?
So again, I always say this, but number one, do not touch your face at any time during the day. Do not touch your face. Try to not do that. I know it's hard, and we always want to fidget with our hair and everything else and rub our eyes, but try not to. I would see if you can find a place within that gas station that you can frequently wash your hands, use a hand sanitizer as often as you can when you do touch surfaces. But this is a situation where I highly recommend wearing gloves. And if you really need to, then you can wear a face mask. So I know on the news right now they're stating, hey, we should have worn face masks, and it's really important, and we would have stopped the spread or decreased the spread if we had implemented the use of face masks. That is the case if, in terms of the fact that if somebody did have a slight cough, them wearing the face mask would prevent other people from necessarily getting sick, because when they cough, they're coughing onto their face mask, decreasing the risk. Again, that risk is still there if someone wears their face mask and decides to touch it, manipulate it, touch surfaces, especially if you're working in that gas station and touching different surfaces or cars or whatnot, and then you're adjusting your face mask and can introduce this virus. So I do recommend wearing a face mask, but once it's on, it's on. Don't mess with it. Don't even touch it unless you've washed your hands or hand sanitized using 60% alcohol or above.
Got it. Great answer. Okay, time for another Skype viewer question. This one is from Johanna.
Hi, Carl and Dr. Anu. I had a question about HIV testing. What does it mean for HIV testing, and how can I get it when sexual health clinics are being shut down, and also local health departments, their staff are being deployed to emergency response?
I think this is a great question, because we're constantly saying get tested and all of that. But during this time, it would seem like getting tested is the last thing anyone's thinking of going to get done.
Are you talking about STD tested or
HIV
HIV counts? And okay.
HIV testing.
But this is where a lot of other primary care physicians and urgent cares are still open. So yes, you may be comfortable with your doctor's office or the infectious disease specialist, but there's tons of resources that are still out there, and it's up to you to call your insurance or figure out what's there and give some of these other doctors and clinics that are somewhat clean clinics that are seeing patients on a day-to-day basis where you can get tested and you can get the necessary materials or necessary medications that you may need.
Okay. This one goes back to sort of the AC and leaving the window open question, but would a portable air purifier help?
Unfortunately not. So air purifier works to decrease the amount of allergens in the air and not necessarily viruses. Again, this goes back to the concept that COVID-19 and viruses aren't really floating in air droplets in the air. They're on surfaces. So unfortunately, the answer is no. But it can help with allergens a lot more. So if you are experiencing runny nose, cough, sneezing, and you think that you may be sick, investing in an air purifier may actually help determine if it is actually due to allergies or anything else.
Okay, and this is going to be the last one because I know we got to get you back to work. We've taken in too much of your time. But I got this question. Somebody sent this to me via Instagram the other day, and they wanted to know what is the best way to find information about which countries provide ARV supplies for international employees or students. So that's to say that if I'm a foreigner living somewhere and I've stuck there right now because flights have stopped, how do I go? What's the best way to find out whether I can get access to these drugs?
I think I'm pretty sure the WHO website has this. And you can look at other non-governmental organizations that are across the board. So Red Cross, WHO, MSF, or Médecins Sans Frontières, all these three places, you just look at any of the email addresses or numbers, and they would be able to give you international information, help to any access that you need.
Dr. Anu, I've taken too much of your time already, but I really appreciate you spending the time answering my questions. What's it like for you there out on the front lines?
This is a tough question to answer. It's fulfilling in certain ways because I know that I have to step up to the plate, and this is my profession. It is also emotionally challenging in certain regards, again, because of the uncertainty and the lack of information that we have regarding this virus. It's also challenging in the sense that we still have to see healthy patients. We still have to continue what we did before, but also change our practices to incorporate the new demands of our community as it keeps evolving and changing from day to day, week to week. And I think it's extremely emotionally challenging for me as a primary care physician when I've made deep and close relationships with a lot of my patients, and when they get extremely sick and having to be admitted to the hospital and having to deal with not only the emotions when it comes to the effect that it's had on the patient, but the patient's family and loved ones. It's challenging, I would have to say. And as a physician, it's the fifth step of what we call with evidence-based medicine. It's self-debriefing. You always ask yourself, could I have done anything differently? And I keep asking myself that at the end of every day, at the end of every shift. Could I have done something differently? Could I have said something differently? Is there something that I didn't know that I could have implemented? So yeah, that's all I can say for now. And every day is a new day, and I get up and pray for the best and hope for the best and go for it.
Well, we pray and hope for the best for you. And again, from all of us at Plus Life, thank you for taking the time out of your busy schedule, taking care of people, to chat with us, Dr. Anu.
Yeah.
That's going to do it for this episode of Plus Talk on Plus Life. For more information, check out our website, pluslifemedia.com. And remember to follow us across all social media platforms. We are at Plus Life Media. Until next time, stay safe, self-isolate, and wash your hands.